Hey everybody, thanks for joining Renewed Mind Breakthroughs with Ashley. Today I want to talk about withdrawal, the downside to getting high. Actually, there's a lot of downsides, but withdrawal is definitely one of them. And I think withdrawal is a lot of the reason why people continue to use, especially opiate addicts. Like they just know they're going to get really sick, and so they want to avoid that best they can. So I work at a detox and treatment center. I have for 5 years almost, and I've been a certified in addiction nursing for almost 4. So helping people through the withdrawal management process is pretty much how I spend my work days, detox. So I wanted to talk about that. Like, I don't even think some people realize that that's out there. Like, you can go to a place and they're going to help you feel a lot more comfortable. It's going to be a lot safer, especially if it's alcohol, because that can cause seizures. I mean, the delirium tremens, strokes, cardiac things, death. Like, you definitely, if you're a severe alcoholic, especially if you have a history of seizures, you definitely want to be in a detox center or hospital or whatever, somewhere to detox safely. So our 3 main people that come in for detox is alcohol, meth, and opiate users. And so I feel like the meth people, they wouldn't necessarily need to be in a detox center. I mean, they're like, let's say you're up for days and you haven't been eating. So what do you think happens? They sleep for days and then they eat everything in sight. Anxiety, you're always going to have anxiety with withdrawal. Those just go together. So they're anxious, they might be irritable, edgy. Their blood pressure is probably going to be high. But other than that, it's just, they can get like moody, sad, depressed. Meth blocks your feelings, and so they might not have realized that they had been hurting their feet or hands or whatever. Now they're starting to feel that pain, things like that. But when it comes to alcohol, that can get really dangerous. A lot of our patients have a history of seizures, or they've had seizures while they're, there. So you really should be in a medical facility. And to treat that, we're going to use a benzodiazepine. We use Valium. So we assess their withdrawal score with the CIWA. And based on their score would be how much Valium we give, how often we give it. So things that we're assessing, always check the vitals, how high is the blood pressure. That doesn't count in the score, but that's always something you see with alcohol as well. That blood pressure is going to be up there, and it's going to stay up there for a while your body heals. So the CIWA, the first thing I'm assessing for is nausea. So it's very common with alcohol. It might just be like, feel sick to your stomach, to full on like dry heaving, like uncontrollable. And in that case, we give IM Zofran. So we inject it because, they're not tolerating anything orally. For the high blood pressure, we'll give them clonidine. That also helps with anxiety as well. We'll give them a muscle relaxer, baclofen. It's a non-narcotic form to, help with all the tenseness and pain and everything that comes along with that. So tremors, this is another thing we assess. Like it can just be like little, or maybe you can only feel it, to full on like their whole body is shaking. Like they can't even walk down the hall because they just are so shaky. You think they were intoxicated the way they're walking, but no, they're just so shaky, sweaty. So that can just be the palms moist to full on beads of sweat, drenching sheets. Anxiety, like I said, that always comes. Like, is it mild, or are they obviously anxious, restless? Agitation, that's very common. They can't sit still. They're constantly shifting around. They're pacing the halls, tactile disturbances. So that's like the sensations on your skin, like tingly, numbness, itchiness, burning. So it might be real mild, it might be severe, like I just want to itch my skin off kind of a deal. Auditory disturbances. So that just might be, the sound is so harsh to, did you hear that? Like someone say my name? Like, hearing things. Visual disturbances, again, so just the light being harsh, the full on, like, what was that? Like shadows or, like different things they'll see. Headache, that it might be like a really bad headache to just like this fullness, kind of like my head feels like it's full or whatever. And orientation, like, how cloudy, or do they understand who they are, where they are, what day it is? Can they, count, do they, how orientated are they? So based off their scale, we give them Valium. And if they have a history of seizures, we're always giving them Valium to prevent those seizures from happening. So alcohol is a depressant, and stopping it quickly can be very dangerous because your central nervous system is depressed, and now it's not, and it can't readjust that quickly. So everything is overstimulated, and that can be really dangerous. It can cause an amino acid spike called glutamate, and that's what can cause some symptoms of the DTs, delirium tremens, the increased blood pressure, tremors, severe excitability, seizures. Now, our opiate addicts, and alcohol and opiates, I don't know who has a worse time. And if you mix those two, oh man, those people have a really hard detox. So we use the COWS scale. And for that, I'm assessing the pulse. So anything over 81 will get a point or more, depending on how high over 80. Sweating, again, that's really common, but it's like they're cold. They're always with a blanket on them, like our opiate addicts. They're walking around with blankets on them. And they're freezing cold, but yet they're drenched in sweat. So cold sweats, hot flashes, things like that. Again, very restless. Like they cannot sit still. They're shifting about. Pupil size, the pupils can get real big. Bone and joint pain, like severe aches, like deep down inside, like, it's so common for, it's an opiate, it's taking away the pain. So again, it's depressed, it's not feeling the pain, and then all of a sudden it does. So it's like overstimulated, hypersensitive. So you're feeling everything so much more intently, and it's just a deep down, like, oh, they ache from, like, their bones hurt, like it just deep down pain. A runny nose, or their eyes will tear, and they're just constantly because their nose is just running. Again, with the GI upset, like their stomach will cramp up, and they'll get loose stools, and feel very sick, very sick. Again, with the shakiness, yawning, just the whole time you're assessing them, they're just yawning away. Anxiety, always anxiety, you guys. Those go hand in hand. And goose flesh, like goosebumps. And again, they're cold, they're sweaty, they get the goosebumps. And so for that one, we give lofexidine, Lucimera, and that seems to help a lot, along with the baclofen to help with the body aches, and then, obviously loperamide for loose stools, or Tylenol, ibuprofen. We use weighted blankets. We use a soaker tub, we have like a TENS unit, to help with any kind of pain, or we have this alpha stim machine that helps with like anxiety or pain and things like that. So there's all kinds of different things that we have to help like distract people and make them feel a lot more comfortable. So if you are going through the withdrawals, like, you can go somewhere and you can make it a lot easier on yourself. You don't have to suffer. There's a place where you can do it safely, especially if it's alcohol. Do it safely. If you got a severe problem, go to detox and do it safely. So, yeah, I hope you got some value from that, or maybe you don't have these kind of things, but maybe you'll notice these symptoms in your loved one and give you a little idea. Maybe help you be a little more compassionate, or talk them into going to detox or whatever. So yeah, I hope you guys are all having a wonderful day. Thanks for joining.